Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name and age, please? Nice to meet you, Mrs. Rubina. May I know what brings you here today? Okay. All right. Anything else? I'm really sorry to hear about your exposure, Mrs. Rubina, and I understand your worries. But before I tell you about effects of exposure on your pregnancy and on your unborn child, I'll ask you a few questions to better understand your condition. Is it okay with you? Thanks for your cooperation, Mrs. Rubina. So, Mrs. Rubina, if do you have any picture of that rash of your neighbor? Okay. Okay, and since how long you were exposed? Okay, if you are in closed room? Okay. Okay, so Mrs. Rubina, if someone is accompanying you, like your husband? Okay. Okay, Mrs. Rubina, if you had MMR in your childhood, don't remember? Okay, and do you have pain in your eyes, sore throat, and runny nose, cough, generalized weakness, fatigue? How about your appetite, Mrs. Rubina? All right. Okay, so Mrs. Rubina, were you tested for Rubella antibodies at the time of pregnancy? No. Okay, so Mrs. Rubina, have you gone through any tests now? Okay, and can I check your labs? Rubina, 25 years, and serology for Rubella and parvo with 19. Rubella IgM is positive. Okay, so Mrs. Rubina, I'm very sorry to say that, this is a condition, serious condition in which if person is Rubella IgM positive, irrespective of Rubella IgG, then statistics shows that, transmission risk to the baby, if exposure is up to 11 weeks, is 90%, okay, of adverse outcome. Okay, and if exposure at 12 to 16 weeks, then there is 20% chance of adverse outcome. And after 16 weeks is minimum, and if mother is infected with Rubella at more than 20 weeks of gestation, then infection does not affect the baby. Do you follow me, Miss? If you are with me, Ms. Rubina? So, Mrs. Rubina, as you are 10 weeks pregnant and you have been exposed to the Rubella virus, according to the statistics, that there is, I'm very sorry to say that 90% chance that outcome will be adverse. Okay, and Rubella can be serious for the baby, especially during first 3 months. Okay, and having Rubella during pregnancy increases risk of congenital Rubella syndrome. Actually, this is a condition that happens when pregnant mother passes Rubella to their unborn baby, and it may cause baby to born with one or more birth defects, including heart, vision, and deafness, intellectual disability, bone marrow problem, liver and spleen damage, and unfortunately there is no cure for congenital Rubella syndrome, and there are chances of miscarriages when can have miscarriage if it happens 2 weeks before, and stillbirths after 20 weeks, and there is 90% chance of giving, birth to a handicapped child. And do you understand? If you are with me, Mrs. Rubina? Can I offer a glass of water? Okay. Mrs. Rubina, see, you know very well that how difficult it is to raise a retarded child, and I've experienced that in such circumstances. I'm really sorry to say it. I understand that how difficult the decision would be for you, but in such circumstances, termination of pregnancy should be advocated, as I'll be referring you to gynae of a specialist for termination of pregnancy. Okay. Go home and talk to your husband. Okay, Mrs. Rubina, and read the information leaflet. Okay, it includes all the information regarding your infection, regarding rubella in pregnancy. Okay. And come back, and whatever you will decide, I'll facilitate that. I'll be with you, okay? You need not to be worried. Okay, Mrs. Rubina, if you are with me. Okay, Mrs. Rubina, if you have been exposed to rubella rash after 20 weeks of gestation, then I would have reassured you that you can continue with your pregnancy despite the exposure, but unfortunately, you are in 10th week of pregnancy, so unfortunately, I don't have other option to offer you. But if you have been, if IgG detected and IgM not detected, then this may can show that infection, but no evidence of recent infection. So I would have reassured you, but here IgM is positive, Mrs. Robina. So if neither IgM nor IgG detector and person is susceptible of infection, we will send a serum again for 1 month. But here in your case, I'll be referring you to a specialist, a gynecologist, okay? But yeah, decision will be yours, go home and talk with your husband and let me know, okay? Yes. Yes, Mrs. Rubina, if you decide to terminate, then I'll offer a postnatal MMR vaccination, okay? And give postnatal MMR vaccination routinely to all women found not to be rubella immune in pregnancy, okay? And so, I'll strongly advise you to avoid pregnancy for 3 months after vaccination, okay? And recheck your immunity after 3 months of vaccination, okay? And then you can, conceive after 3 months of vaccination, okay? If it makes sense to you. Okay. Should I repeat it again for you? Yes, Mr. Rubina, and after that you can conceive and you'll be blessed with a healthy child, okay? And just don't lose hope, okay? And I'm here to support you, okay? Is everything clear till now? Should I summarize for you? Okay, Mrs. Rubina, take good care of yourself. Bye-bye.